Hospitals that do not heal, but rather compound illnesses. An excellent article by Pilar Ingemio for DTP News and DTP Media, the latest service from the OK News press agency, offering real-time verified information. Do remember that we are broadcasting from our editorial studios to the entire world, from Calle Gran via 84, in the very heart of Madrid, here in Spain. Informed consent exists, the obligation to inform the patient, who must then accept or decline treatment. Some time ago, I contemplated writing on this subject, yet for various reasons, I refrained. Today, however, I feel compelled to do so, for the sake of those who have fallen victim to an intricate web of corruption, where the sick are not only left uncued but subjected to irreversible and deleterious side effects. Informed consent exists, the obligation to inform the patient, who must then accept or decline treatment. I shall not divulge whether it was I or another who bore witness to unspeakable atrocities inflicted upon a loved one, but I shall not deny that I have seen them. And my duty as a communicator is to expose and denounce injustice. A woman is admitted to the emergency department of a private hospital in Compostela with a diagnosis of cellulitis, fluid retention, and edema in the legs. The prescribed diuretic treatment is appropriate and successfully eliminates the excess fluid. However, upon her transfer to a ward, in a most baffling turn of events, the attending physician discontinues the diuretic and instead administers a nebulization for asthma, an affliction she does not suffer from and to which she is, in fact, allergic. The patient subsequently experiences dyspnea, prompting a nurse to administer Erbison twice daily for a week, despite full knowledge that corticosteroids exacerbate edema and induce severe spikes in blood sugar. The edema worsens. The diuretic is later reinstated, albeit aggressively, for ampoules at breakfast instead of being evenly distributed throughout the day to avoid a precipitous drop in blood pressure. The patient's companion raises concerns with medical staff, only for the doctor to appear the following day, flanked by 2 nurse witnesses, and declare that the patient must either accept the prescribed treatment or be discharged forthwith. Such conduct constitutes outright harassment of an elderly individual, left in an unfit state to be discharged. When eventually released, the reason for admission is falsified, changed to dyspnea, a condition provoked by the very treatment administered and far removed from the original cause. As if this were not enough, one cannot ignore the audacity with which the patient is informed that she is now in a worse condition than upon arrival. And the curative power of words that heal rather than harm, words essential to the recovery process, has vanished. Degrading, abhorrent. And this, within private healthcare. In Compostela's public healthcare system, specifically at the Clinical University Hospital, there exist many commendable professionals. However, trouble arises when elderly patients are transferred to the provincial hospital of Conxo, particularly to the internal medicine ward, where policies suggest a veiled form of euthanasia, seemingly aimed at eliminating the elderly. The first course of action is the withdrawal of essential heart and blood pressure medications, leading to inevitable deterioration and, in numerous cases, death. Should a patient's companion object to this discontinuation of vital medication, the response is simple: the door is that way. In such circumstances, voluntary discharge appears to be the most prudent course of action. Those who have lost loved ones now regret not having had the courage to leave. Returning to private healthcare and the same physician previously mentioned, the very same English patient is readmitted for the same condition, now complicated by anemia. 2 blood transfusions are administered, raising hemoglobin levels. Diuretics help eliminate excess fluid, yet upon the introduction of iron supplements, the patient regains the 4 kilograms previously lost. A consultation with a leading hematologist confirms that iron supplementation is contraindicated in cases of renal insufficiency, as it induces edema. The treatment is duly halted, yet the doctor refuses to acknowledge any error, dismissing it as mere coincidence. Upon cessation of iron therapy, the patient successfully sheds the excess fluid, albeit at the cost of severe hypotension. Most astonishingly, following her discharge and with the fluid now eliminated, the physician inexplicably prescribes the very same iron supplements that had previously triggered edema, thereby reigniting the issue. This entire ordeal spans nearly 40 days of hospitalisation, with a wholly inadequate diet for a patient's recovery. That said, The cleaning staff and housekeeping personnel carried out their duties diligently, and there were healthcare professionals and nursing assistants who demonstrated true vocational commitment. Lest there be any doubt, this is intended as constructive criticism, for one cannot remain silent when lives are at stake. I must not overlook the fact that patient care often translates to patient neglect and the staunch defense of hospital interests. I felt I could not remain silent. My only hope is that they recognize their errors and amend their ways. Nothing more need be said. I believe my point has been made. Pilar Ingemio's article denounces malpractice and medical negligence within both private and public hospitals in Santiago de Compostela, Spain. She presents concrete cases of improper treatment, lack of informed consent, and even what appears to be covert euthanasia targeting elderly patients. As a communicator, she seeks to shed light on these injustices that compromise patient health, leaving individuals not only uncued but subjected to detrimental side effects and dehumanizing treatment. Her aim is to provoke constructive criticism, urging healthcare institutions to acknowledge and rectify their mistakes, prioritizing patient care and well-being over institutional self-preservation. We invite you to read Pilar Ingemio's full article on DTP Media and DTP News by OK News. Until our next report.